Well, welcome back, everyone. Today we are joined by Brian Scheid. He's the Director of Cardiopulmonary Services at Lima Memorial Health System. And today he's going to be sharing information on what you can expect when you need further care after a vascular screening. So thank you so much for joining us, Brian.
Thank you for having me.
My pleasure. All right. Well, firstly, can you share with us what a vascular screening is for?
Yeah, vascular screening is a great option for people to get a better understanding of their risk for cardiovascular disease. So cardiovascular disease can be a silent disease, something that happens as we age and get older. And oftentimes we don't see symptoms or really know that we're developing vascular disease. So screening is a very simple, painless opportunity for patients to come in and have a few ultrasound studies, go through some of their medical history, and see if maybe they have some advanced risk for vascular disease.
Right, and you did mention risk, so I was going to ask you, what kind of results may be concerning to our provider?
Right, so during this testing, we're looking at blood flow to important parts of your body. So we look at the arteries in your neck that supply blood flow to your brain. So if we see plaque buildup in those arteries, or maybe blood flow that's limited, it can be a sign that you're at early risk for stroke. Likewise, we look at the large artery in your belly called the abdominal aorta. We want to know if that has any chance for weakened walls. I'm sure folks have heard of aneurysms. And so if we find any of those types of findings, we want to make sure we're letting patients know and we're getting them back in for further testing and treatment to help mitigate those risk factors so they don't have strokes and they don't have aneurysms.
Right. Now, how does LMHS, Lima Memorial, assist patients with their follow-up care needs?
Yeah, what's great about these screenings is if you have abnormal results, we know right away. And so we're able to connect you with all of our specialty physicians that take care of these types of disease processes. We have vascular surgeons. We have a great team of cardiologists that are here to be able to help as well. And so we can get your appointments set up very quickly to have you come in, talk with one of our medical professionals, and decide if further testing or even treatment or intervention is necessary for you.
All right, perfect. Now, if someone would actually like to schedule a vascular screening or even just learn more, who can they call?
Yeah, for scheduling or any questions, very simple. You do not need a physician's order for this testing. You can just call on your own. The number's on the screen there at the bottom. Our schedulers will answer any questions that you have or get you set up for the screening, and we can get that done very quickly here.
All right, sounds easy peasy. Well, Brian, thank you so much for joining us today. I appreciate it.
All right, thank you. I appreciate it as well.
All right, well, don't go away because we have more when we return.